Advances in technology have provided increased opportunities to reach patients outside of the doctor's office. Whether living in rural areas or limited by physical disabilities, telemedicine and telehealth can provide patients living with MS the opportunity to access quality health care.
You can have the world at your fingertips. Technology nowadays allows us to do that. We can hop on a computer, we can hop on our tablets, pick up our smartphones, and just by clicking, we can connect to anybody, anywhere in the world. Certainly, telecommunications have advanced significantly since the 20th century when they were developed. At the same time, we have had an advancement in information technology. So the combination of telecommunications and IT have brought us to a state where physicians and medicine in general need to take advantage of those capabilities. The combination of those two areas result in what's called telemedicine or telehealth. Two terms that are slightly different, but that are used interchangeably to mean that we can provide healthcare through a remote location using telecommunication devices. I am Dr. Gabriel Pardo. I am the associate member of the Arthritis and Clinical Immunology Research Program at the Oklahoma Medical Research Foundation, OMRF, and the medical director of the OMRF Multiple Sclerosis Center of Excellence. Telemedicine is something that we need to embrace in the 21st century. It has been around for quite some time. There are very different types of telemedicine. If you think of it, very early on, when we had the ability to talk to the phone, we were having a remote connection between a patient and a healthcare provider in order to deliver care. And then those became mobile with the advent of cell phones. The first cell phone call was made in 1973, but it was not until 1983 when they became commercially available. You remember those, bulky, large bricks that were not very easy to carry. But since then, things have advanced tremendously. It is estimated that 95% of Americans own a cell phone. 77% of them have a smartphone. Yes, there are some people that still have flip phones, and they do not have the capabilities to connect aside from making phone calls. But the technology is widespread. The advancement of electronic medical records has allowed us to also create those communications directly with a physician's office. We can use other modalities aside from phone calls. We can use emails, we can use texts, we can do connection into the electronic medical records and leave messages to our providers. In that way, they can get back to us with answers to our medical questions. Those are early and simple ways of doing telemedicine. But things have advanced since then. And with the capability of doing video conferencing, meaning that we can talk and see each other in real time, even though we're not in the same location, then the opportunities for providing healthcare through that modality are tremendous. There are basically three forms in which we can use telemedicine. One is called store and forward. Basically, you're going to collect information that stays available until the other party pulls it out and analyzes it. A very simple example of that is your MRI. MRIs that you have in a routine follow-up for your multiple sclerosis will be stored, and the radiologist or your physician will pull those up later on and evaluate those. We also have telemonitoring, where through different sensors, we can be evaluating things like vital signs. That technology was pioneered by NASA in the 1960s when there was need to evaluate the vital signs of the astronauts when they were out in space. But then we have real-time telemedicine, and that perhaps is much more relevant for the purposes of multiple sclerosis. And you can use real-time telemedicine in many different ways. We can do education, which is a very important component, because the more you know about your disease, the better advocate you're going to be in your own health care. We can use it to coach you through different processes. We can also use it to do mental health evaluations in general. And this is something that is very conducive to be done through this modality. After all, with mental health, you do not need to have direct physical contact with an individual. But beyond that, we can do evaluations through telecommunication. We can examine a patient with the use of a proxy that is next to the patient. And telecommunications have been used in emergency situations. And beyond that, in areas where hands-on are very, very important to do. For example, surgery. Nowadays, we have the capability for a surgeon being in a remote area through telemedicine, operating robotic equipment that will do surgery in someone. We can also do telerehabilitation or physical therapy, something that traditionally we have thought you have to be physically present to undergo. And studies have demonstrated the benefit of those approaches. Why do we need telemedicine in multiple sclerosis? There are multiple different reasons. The one and the most evident of all is access. If you are in a remote area, if you live in a rural area, then you are not going to be close to specialized services that you need. And then doing it through telecommunication, through telemedicine, will be a very good option. But beyond that, it is also relevant in large metropolitan areas, in urban areas. If you have a physical disability and you have to mobilize yourself with high frequency to go to physical therapy or to your physician's office, negotiating public transportation might be quite difficult. So that is another opportunity for telemedicine to change the quality of life of individuals with multiple sclerosis. In MS, as I mentioned, we use telemedicine significantly to analyze imaging studies, MRI studies. And some few centers have taken that a step forward and are able to communicate with their patients and evaluate them in their home environment. This has a lot of advantages because we're able to then see the patient in the real setting, analyze other problems that may be contributing to their quality of life that we, having eyes into their home, will be able to help them with. There are several barriers, though, that we still need to conquer in order for telemedicine to be something that is widespread use. For one, the technology. It's not accessible to everybody. High-speed internet is not available all around the country. We have concerns about privacy. After all, we hear these stories about hackers getting information that is private, and healthcare information is very sensitive to that. We have problems with licensing. A healthcare provider will have a license to practice in a specific state, and with telecommunications, we might be doing this across state lines. And when doing so, then we need to contend with those factors. And then there's a very important aspect, and that is the one of reimbursement. Federal health insurers do not cover telemedicine for the most part. Some private insurers will not cover that, specifically telerehabilitation. So it's important for us as an MS community not only to be knowledgeable about this capability and to utilize it more so that we can communicate better and derive benefit from that, but also to have a support to the movement to allow these modalities to be reimbursed for them to become much more popular and accessible. I hope to see you in cyberspace.